remedy from Phatak Materia Medica, that is Ammonium Carb, on the 27th episodes of Phatak Materia Medica live series. So let us start. It is a big remedy, so we have to take it will take much time. So let us start. So Dr. Phatak clearly described this is a remedy of slow sinking and collapse remedy. So it affects the circulation, heart and blood. The heart becomes weak, circulation becomes sluggish, blood becomes under-oxygenated. So then what happens? Lividity, weakness, drowsiness and lack of reaction. This is a slow reactive remedy. These patients do not fight disease, they sink under it. So which type of patient? Dr. Phatak described it as patient with fat, stout patient, weak heart, wheezing, suffocative feeling, sedentary life, takes cold very easily, always tired and weary, especially in stout women before and during menses, cholera-like symptoms with menses. So this is the classic picture of the ammonium carb. Thermally very sensitive to cold air, aggravation from cold, damp, cloudy weather, cannot tolerate raw, cold open air, even water is unbearable. So Dr. Phatak says great aversion to water, cannot bear to touch it. This is not fear, or this is a low vitality intolerance. So what is the central theme of ammonium carb? It is collapse, exhaustion from thrombolysis, lack of reaction. This patient often runs like this. His life runs like this: small exertion, great frustration; small stress, mental exhaustion; small exposure, collapse. So patient may say that, doctor, I wake up tired, talking itself exhausted me, talking itself exhausts me, listening to others drains me. This is ammonium carb. They are active mentally but soon exhausted. They want they want to function but their battery is already dead. Mentally active, soon exhausted, forgetful, ill-humored, gloomy especially during stormy weather, depressed with weakness of intellect, vacant mind, aversion to work, disappointed to disposed to weep, makes mistakes in speaking, writing and calculating. So Dr. Phatak says hearing others talk or talking himself affects him, exhausts him. This is very peculiar and useful in day to days. These patients are peevish, free, feels guilty as if crime has been committed, cry easily, gloomy without reason. But there is no violence, no insanity, only weakness. So don't confuse this with depression of ammonium moor, ammonia natrum moor or aurum. In this is not emotional depth. The mental fatigue is due to the physical collapse. The mind is willing but vitality refuses. In physical journals, the remedy gives lives in general, not in fantasy or peculiars. So, ammonium carb is marked chilly remedy, aggravation from cold, aggravation from cold damp weather, aggravation from raw cold open air, worse on cloudy days, aggravation from 3 to 4 am. This is not a simple I like warm, but it is a collapse on exposure. Aversion to water, cannot bear to touch it. Patient says that this is not hydrophobia. Patient may has this is not a total it is not a hydrophobia, it is a low vitality or intolerance. Patient may say that, doctor, cold water makes me sick, Bathing is like a exhaust me. Very strong conformation, energy. This is the one of the best remedies from exhaustion from little things. Prostration from little thing, lies down from debility, vitality become low reaction. So patient in day to day's OPD may say that, doctor, I get tired without doing anything. If this sentence by patient, ammonium carb should be come into the your mind. Weak heart, weak blood and weak reaction. So as earlier said, as Dr. Phatak described it as aggravation from cold, damp cold, cloudy weather, raw open air, motion, chewing, pressing teeth, bending down during menses, falling asleep 3 to 4 am, new moon. Better by pressure, eating, lying on abdomen, dry weather, lying on right side. Appetite, but easy satisfaction, early satiety. In stomach symptoms, pain at the pit of the stomach, heartburn, water brush, nausea, chilliness with gastric complaints, flatulent dyspepsia, stool, bleeding piles, aggravation during menses, blood before and after stools, protruding piles, cannot walk due to the piles, better by lying, constipation, dry hard stool, or diarrhea, dark acrid diarrhea. So if you say piles, weakness, fat patient and cold sensitivity, you must not be forgot ammonium carb. In sleep, sleepy during days, walks with strangling, aggravation from failing sleep, aggravation at 4 to 3 to 4 am. This is the cardiorespiratory involvement during the sleep. So Dr. Phatak says the sooner one goes to the bed, better one sleeps. This shows that exhausted nervous system. In general, particular symptom, heaviness in the all organs, bruised and sore pains, internal raw burning, discharges are hot, acrid and adherent. Hemorrhages dark, thin, parts laid on become numb. Again, this is a circulatory failure. The action of the ammonium carb is on the heart. So, the Dr. Phatak says that it affects heart, circulation and blood. This is not a theoretical. This is a clinically visible. In heart symptoms, heart becomes weak, circulation sluggish, blood under oxygenated, stasis and collapse. This leads to lividity, cold sweat, weak pulse and drowsiness. So, weak heart palpitation, angina pectoris, palpitation from fear, cold sweat, lacrimation, trembling in the hand, inability to speak. Wakes with difficulty in breathing at night with palpitation, aggravation during sleep, aggravation in the early morning. In heart symptom, weak heart, cold plus exhaustion, think of ammonium carb. In respiratory system, increase or difficulty in breathing, aggravation from sleep with dyspnea, operation of breathing, aggravation from exertion, aggravation from entering in the room, better by cold air, wheezing, rattling in chest but little expectoration, emphysema, pulmonary edema, hypostatic congestion of the lung. So, in day-to-day modern practice, cardiac insufficiency, hypostatic lung congestion, post-influenzial weakness, emphysema in elderly or stout patient, you may think of ammonium carb. Breathlessness from weakness, not from the spasm. In the head symptoms, violent headache, fullness and bursting in the forehead, brain feels as if loose. So, circulatory pressure plus nervous weakness. In eyes, it is asthenopia remedy. Eye symptoms are burning and dryness, asthenomia from prolonged use, yellow spot on white object, Black floating spot on swing, flood of the tears, pain better by the after falling the sleep. So this is eye fatigue from weakness, not reactive or alone. In ear symptoms, hardness of the hearing, itching above the ears, spreading over the body. So hard swelling of parotid and cervical gland. Again, glandular but low vitality. In nose symptoms, nose block at night, long continued coryza, must brace to the mouth, snuffles of the children's, inability to blow nose in the children, profuse watery coryza, continued urge to sneeze, epistaxis, aggravation from washing hand and face after eating or walking. In face symptoms, boils and pustules during menses, cracks and burning lips, sore corners of the mouth, hard swelling of the cheek. So this again shows that poor healing with low resistance. In mouth symptom, tender, bleeding gums, loose, fluent teeth, vesicles on the tongue, burning mouth, cannot eat or speak, pressing of the teeth causes shock through the head. In throat complaint, enlarged tonsils, gangrenous ulceration of the tonsil, diphtheria, nose block, membranes extend to the upper lip. This shows that low vitality with septic condition. When infection spreads because of resistance is low, think of ammonium carb. In abdominal complaint, it is like circulation, digestion and weakness. So flatulent dyspepsia due to the above secondary symptoms of the low vitality, colic, pain in abdomen with chilliness and colic with pain in between scapulae. In rectal symptoms, bleeding piles, aggravation during menses, blood before and after stool, protruding piles, cannot walk due to the piles. In urinary, frequent desire to urinate, involuntary urination, urine white, bloody, sandy, turbid, foul smelling and copious. So this again points to the low tone of the sphincter. So in OPD, elderly, weak, stout patient with night urination with cold sensitivity, think of ammonium carb. In male complaints, persistent erection without desire, violent sexual desire with erection, also frequent seminal erection or emission after caution. So sexual irregularity from weakness, not from passion. In female complaints, very important, it is female dominant remedy, menses too early, too frequent, profuse and clotted. Black, with colicky pain, hard difficult stool during menses, fatigue of the thigh, yawness and chilliness. So menses flow more in the night, the dyspnea or then dyspnea or weakness. This is cardiac stress due to the menstruation. Leukorrhea, copious, watery, acrid, burning. Again irritating discharges. Clitoris, irritation of the clitoris. In extremity, pain on lane parts become numb, cramps in the calves and soles. Hands and fingers swell when arms hang down. Right foot numb. Right arm heavy and weak. Ganglion, tearing pain better by warmth, bed and inclination to the stretch. In skin symptoms, red and mottled skin, erysipelas in aged, malignant scarlatina, scorbutic status. This shows that septic tendency to low vitality. Infection spread and becomes defense weak. So ammonium carb in day-to-day practice, early heart failure, post-viral myocardial infection, elderly patient with low BP, with fatigue, angina-like symptoms without strong pathology. So there are many much remedies which are very close to the ammonium carb. These remedies are, first remedy is carbovegetabilis. So carboveg and ammonium carb has chili, cold intolerance, weak heart from inside, aversion to water. Carbohydrate wants air and fan. Cannot cold but desired air strongly. Collapse after losses. Bluish but reactive to air. Carboveg has collapse after drain. Ammonium has collapse by constitution. Another remedy is antim tart. So we must differentiate these two remedies, antim tart and ammonium. Ammonium carb has rattling with weakness, antim tart has rattling with choking. Ammonium carb has little expectoration, heavy heart involvement, cold sensitive. Antim tart is drowsy but wants to left alone, tongue is coated white, more acute chest picture. So antim tart is acute chest emery, ammonium carb is chronic collapse remedy. Another remedy very close to the ammonium carb, my one of the mentor says that ammonium carb is chemical lacasis. Ammonium carb is chemical lacasis. So in ammonium carb, chilly, aggravation from cold, weak, exhausted, sleep better, sleeps better early. Lachesis has hot, aggravation from sleep, intense talkative, congestive and violence. Lachesis is intensity, ammonium carb is insufficiency. Another remedy is gloninum. So ammonium carb has weak circulation, collapse, cold sensitivity, slow sinking. Glonine has sudden congestion, throbbing pain, heart intolerance, heat intolerance, explosive symptoms. So glonine has pressure explosion, ammonium carb has pressure failure. Another remedy is muriatic acid. So ammonium carb is weak but still reactive, wants to lie down, chilly, slow decline. Muriatic acid have extreme prostration, slides down in the bed, jaw drops, almost no reaction. Muriatic acid has terminal weakness and ammonium carb has pre-terminal weakness. Another remedy is digitalis, ammonium carb, weak heart with coldness, breathlessness during sleep, general collapse. Digitalis has weak heart with slow pulse, fear of death, great green vision, cardiac pathology is clear. So digitalis is heart specific while ammonium carb is systemic collapse. Another remedy is calcarea carb. Ammonium carb has stout but weak, poor reaction, cold intolerance, extreme suffocative sleep. Calcarea carb has stout but stable, sweaty, slow metabolism, fearful but strong vitality. Calcarea carb is slow but strong, ammonium carb is slow but weak. So another remedy is sulfur. Ammonium carb is chilly, cold intolerance, weak exhaustion, sleeps better early, suffocative sleep, dirty, unclean habit from weakness. Sulfur is hot patient, loves open air, standing thinker, active, sleep badly after 5 am, burning everywhere, dirty from neglect or indifference. Sulfur is fire still burning, ammonium carb is fire almost out. So these are the some remedies which are very close to the ammonium carb. So prescribing totality for ammonium carb is fat or stout patient, marked chilliness, aggravation from cold and damp weather, weak heart, poor circulation, breathlessness during sleep and on exertion, exhaustion from little things, aversion to water, aggravation from 3 to 4 am, better by lying down, and pressure, mental fatigue, forgetfulness, gloomy symptoms, aggravation during menses. So, if you see weakness, cold intolerance, cardiorespiratory distress, poor reaction, think of ammonium carb. This remedy is prescribed when life runs on emergency power. So, in remedy relationship, as already we compared the remedies, carbovage with collapse after drain, antim-tart with acute chest congestion, lacasis with congestive intensity, glonine with sudden vascular pressure, and muriatic acid with extreme prostration. So, acute collapse, think of antim-tart, carbovage. Chronic low vitality, ammonium carb. Terminal weakness, muriatic acid. This is clinical thinking that developed from day-to-day practice. In potency, I use in 30, 200 and 1 m. In 30, mostly used in allergic rhinitis, nose block in children, nasal polyps, deviated nasal septum, and heart congestion. In 200, in menorrhagia and metrorrhagia patient with dysfunctional uterine bleeding, it gives very good results. So, when we think of ammonium carb, aversion to water plus chilliness is low vitality, think of ammonium carb. Breathlessness during sleep is very significant. Menses aggravates weakness, confirms the remedy. If patient looks worse than reports, think of ammonium carb. So, in 3 words, cold, weak and collapse is ammonium carb. So, ammonium carb is the remedy for survival, not for the struggle. Thank you for patience listening. This is a very long remedy. I have tried to cover each and every aspect as Dr. Phatak described. But so thank you very much. Let us see in next episode. Thank you very much.